Morning, sir. Good morning, ma'am. I am going to present. This is a presentation based on my thesis topic, evolving trends in altered sensorium, an observational cross-sectional study in a tertiary healthcare center in northern India. Altered sensorium is a frequent and critical clinical presentation in the emergency department and inpatient practice, encompassing a spectrum from mild confusion to deep coma. It reflects disturbances in the fundamental components of consciousness, arousal, and awareness. This condition poses a diagnostic challenge as varied etiologies can present with similar clinical features, leading to potential delays in management and increased morbidity and mortality. Evaluation involves clinical assessment using tools like Glasgow Coma Scales and along with laboratory and neuroimaging investigations to identify reversible causes. This study aims to analyze the etiological profile, clinical and biochemical parameters, and prognostic indicators of altered sensorium in patients presenting to MMISR Mullana, which is a tertiary healthcare center in northern India. This study, observational cross-sectional study, was done from April 2024 to June 2025 after obtaining approval from the ethical committee of the institution. Patients were taken from the emergency department and medical intensive care unit. After obtaining written consent, all the participants underwent history and physical examination and biochemical and relevant radiological investigations as per the pro forma of my thesis. Inclusion criteria was all the patients who presented with GCS less than 15 and were above the age of 18 years and admitted to our hospital, and those who consented to participate in the study. The patients who had less than 15 GCS but were having trauma like head injury and post-operative patients and patients with known neurological conditions and psychiatric illness were excluded from the study. The sample size total of the study was 250 patients. As usual, proper written and informed consent was taken from all the patients. Clinical history and examination, all relevant investigations were done. Scoring systems like SOFA and Apache 2 were used to calculate the risk and prognosis at the time of admission. And patients were followed up till the hospital stay, and prognosis were determined based on the duration of the hospital stay and the mortality of the patients. Data was collected on predefined pro forma and statistically analyzed. Among those patients that consented, 109 patients had to be excluded due to different reasons, like 24 patients had head injury and trauma, 11 patients were of age less than 18 years, 46 patients were diagnosed with chronic psychiatric illnesses and known neurological conditions, and 28 patients left against medical advice. All the other patients, that were 250, were followed up for during the time of their hospital stay. This is the comprehensive result that I gathered during the study. Patients with etiology of sepsis, that is infectious causes, had the highest case fatality rate, and those with respiratory infections especially had the highest fatality rate, which is around 69.2% for the overall infection or sepsis category. Patients that presented with metabolic causes had the best outcome, and around 87.5% of the patients who presented had an uneventful recovery. Patients with neurological disorders had a good recovery rate, had less mortality relatively, but they had a prolonged hospital stay, which may be due to the prolonged need for rehabilitation and physiotherapy to return them to their usual lifestyle. Various clinical and laboratory parameters were assessed during the hospital stay of the patients, and among them, among the clinical parameters, mean arterial pressure, SpO2 and GCS had significant correlation with the outcome. Low SpO2 and low GCS had a poor outcome. Among the biochemical and biochemical parameters, high TLC, low platelet count, low albumin, high urea and high creatinine levels, low pH, low PO2, low bicarbonate and high lactate levels had a significant correlation with poor prognosis. In the severity scoring systems, SOFA and Apache 2 were estimated, and the SOFA of the surviving patients were 14, while the mean SOFA in the patients who did not survive was 24.9, and also Apache was 14 and 24.9. SOFA was in the mean survived patients was 4.33, while in the patient who did not survive was almost double, that is 8.61. ROC analysis was done among the parameters that showed significant variations, statistically significant variations, and among them it was seen that Apache 2 had a highest area under the curve, signifying that it has a highest correlation with the outcome of the patient. It has also a high sensitivity of 71% and a specificity of 87%. SOFA and Apache had shown excellent performance in predicting the outcome and also lactate. And other parameters like mean arterial pressure, albumin, TLC and creatinine and GCS were not that much up to the mark in predicting the prognosis of the patients. Conclusion. In our study, sepsis emerged as the leading cause of altered sensorium and was also associated with highest mortality, particularly when linked to respiratory infections. Patients with neurological disorders needed a longer hospital stay, but with the necessary care and rehabilitation, they showed potential for recovery. These findings emphasize the importance of early recognition of the underlying etiology in guiding prompt treatment and improving survival. When comparing prognostic tools, integrated scoring systems proved more reliable than individual clinical or laboratory parameters. Both Apache 2 and SOFA scores showed strong predictive ability and outperformed single measures. Therefore, combining structured severity scores with simple bedside parameters can serve as an efficient and evidence-based framework for early risk stratification and timely intervention in patients presenting with altered sensorium. Along with this, I also noted that in similar previous studies, the leading cause of altered sensorium was mainly neurological involvement, and however, in my study, the leading cause was sepsis. This is a recently changing trend that has been noted, that may be probably due to that in initial stages of infection, patients usually take over-the-counter medications, and even antibiotics are freely available. So often they get less than required treatment and only present in the emergency department, especially of tertiary healthcare centers when they have significant organ dysfunction, and which often presents as altered sensorium.